Is sponsored by the National Council on Aging. Older adults have an increased risk for illnesses like the flu, COVID-19, and RSV. But there are ways to combat these sicknesses. And here to share more on that is Dr. Maria Teresa McPhail, President and CEO of VITA Senior Centers. Dr. McPhail, thank you for being here.
Good morning. Thank you for having me.
Sure, of course. So how risky is COVID-19 right now for older adults?
Yeah, that's a great question. Right now, I think that comparing with the beginning of the pandemic, the risk has decreased a little bit, not because of the intensity of the disease, but because there is a lot of work that has been done to cover the seniors. So 95% of the population, at least the population we serve, have at least 3 vaccines already. So I think that is the reason why it's a little less dangerous than before, but COVID is still around, so we still are encouraging seniors to get protected. One of the reasons why we said that there is never a room to put the guard down with seniors, because it's risky due to their immunity problems. Most of our seniors have these chronic disease conditions, and they are battling, with certain comorbidities as well, and that make them and put them in a little more risk than the regular population.
Sure. And what are the latest COVID vaccine guidelines for older adults?
Yes, so we are telling the population, according to the CDC, the new dose that just came are to just get the new vaccine on the arms, right? There was the last booster, and now this is the latest available vaccine that came in October. And the guidelines are saying that if the person had an interval of 2 months without the vaccine, they are exposed already. So we are recommending the vaccine as now.
Okay, thank you for sharing those guidelines. And does it cost anything to get the COVID vaccine or the flu vaccine?
No, right now, many of the people receiving the vaccines are insurance. There is a small population, like 20% of the population we are serving in Washington, D.C., they are uninsured. But because of the necessity of covering everyone and access to vaccination, the government has delivered many alternatives, and one of them is a bridge program that people can take advantage of it. This bridge program includes people that don't have insurance coverage, and they don't have to pay anything. So they are making the vaccines accessible for those who cannot be covered under the insurance. And the ones that have insurance, they have full coverage.
Okay. And I think a lot of people want to know, can they get the COVID vaccine and the flu vaccine at the same time?
Absolutely.
Okay.
The recommendations are that they can have both vaccines the same day, unless they have experience in the past, some side effects or discomfort. They recommend do separate appointment. But otherwise, if the people didn't feel any side effect at the first or the last shot, it's recommended to have both vaccine at the same time.
Okay, great to know. And where can people go in the DC area to get their COVID or flu vaccine?
Yeah, we have several areas here. We work directly with providers in the area, pharmacies, CVS, Giant, and healthcare providers. For us as VITA, we look for people that has Hispanic services because of the language access. So we have many mobile clinics as well coming around to deliver the vaccine. And we also, as an organization, we are scheduling vaccine events so people can have access to vaccines. So we have pharmacies in every corner here, and they have availability of vaccine for everyone who needs it.
Dr. McPhail, thank you so very much for sharing this really important information.
It is my pleasure. Thank you.
For more information, head to ncoa.org.